So let's get started. Welcome to our November Policy and Research webinar, focusing on ageing reforms for LGBTI older people. So my name is James Zanotto. I'm the Policy, Research and Communications Director here at LGBTIQ+ Health Australia, and my pronouns are he, him. I'd like to begin by acknowledging the traditional custodians of country throughout Australia, their diversities, histories and knowledge, and their continuing connection to land and community. We pay our respects to all First Nations people and to elders past, present and future generations. Please feel free to use the chat today to acknowledge the land on which you're on. Now, just a couple of housekeeping items before we get into the business of our webinar. I'd like to let everyone know that we're recording the webinar today and that it will later be made available on the LHA website. So if you miss any information or you'd like to share it with someone else, you'll be able to find it there and go back and listen. And after our presentations, there'll be an opportunity to ask questions. So I invite you to use the Q&A function, so not the chat function, the Q&A. So for most Zoom users, that's located at the bottom of your screen. So please feel free to ask questions at any time, and we'll come back to them after the presentations. And if there's anything in this webinar today that raises concerns for you, there is help available, and you can contact QLive, which provides Australia-wide anonymous support for the LGBTIQ+ community. The number is 1-800-184-527. So now to formally welcome our speakers. We've got two presentations today. First up, I've asked Michael, who is Policy Research Lead here at LGBTIQ Health Australia, focused on ageing issues, to give us a brief update and a reminder about what we heard about the needs of LGBTI older people during the Aged Care Royal Commission. And then with that background, I'll pass across to Robert to give us an update of the reforms that are underway. And Robert is the Assistant Secretary of the Dementia, Diversity and Design branch of the Commonwealth Department of Health and Aged Care. He brings with him over 15 years of professional experience in the Australian public service, as well as experience as a volunteer and board member for local charity and not-for-profit organisations. So very much welcome to both of you. Michael, across to you first.
Thanks, James, and hi, Robert. Looking forward to hearing your presentation after this, and thank you everyone for bearing with us. It's great to have you all here today. As James has said, everyone can hear me okay? Just check that first, yes. My name is Michael Frommer. I am the policy lead in the ageing space here at LGBTIQ Health Australia. I use he, him pronouns. And I also would like to acknowledge the land on which I am today, which is the land of the Gadigal people of the Eora Nation, and pay my respects to elders past and present and any First Nations people who are joining us today. Okay, so as James indicated, I'm going to just talk us through some of the things that LHA heard over quite a while when we were doing our listening in order to inform our submissions to the Royal Commission into Aged Care that obviously we all know happened now a number of years ago. So we engaged in a range of community consultations to inform them, and there were a number of submissions we did, which are on our website. Just giving you a few of the titles: the impact of COVID-19 on LGBTI people using aged care services. We had a submission focusing on the specific communities that are distinct and also have overlapping concerns: lesbian, gay, bisexual, trans and intersex. We had a submission on community visitor scheme, which I know some of you are familiar with. We had a submission around workforce issues, obviously a central element in the aged care reforms, and the future design of the aged care system. In our consultations with older LGBTI people, we heard a range of views that did reflect the varied experiences across the spectrum across the LGBT and I spectrum. And I know some people on the call today are from LGBTI community controlled organizations and no doubt are familiar with this, but I think it's always important to emphasize that there is a range of experiences and some quite different ones depending on the particular part of the spectrum that someone may be from. So some of the issues that were raised weren't LGBTI specific, rather they were about priorities that any older person might have, including things such as access to good nutrition, stimulating activities, and healthcare. On the other hand, many issues were specific to the diversity of LGBTI people and were of significant concern to them. So I'd like to actually share with you a few quotes so we can hear the views of older LGBTI people in their own words about what most concern them. So this is from the perspective of an intersex person talking about receiving personal care. And they say, I would feel really uncomfortable receiving personal care, just because of the scars and the memories of being examined by so many doctors. And that is someone who's self-identified as a 60-year-old intersex woman. A gay person. My friend had known this, my friend had known this out gay man for years. The moment he went into this facility, he was told he had to suppress his gay identity. He was told this. He felt he was back in the closet for the first time in 40 years. Some of these hardwired workers need years of therapy to unlearn their homophobia. People may pretend to be very open-minded, but when it comes to the crunch, they're not. 72-year-old regional gay man, trans person. A transgender woman I visit never seems to have her hair or makeup done as part of a daily routine offered to other women. Only when an LGBTI visitor attends do they do this care voluntarily. And that was actually from a non-binary regional aged care worker. In another trans perspective, they still call me he and him, and it hurts. It really hurts. And actually, once again, that's from a 39-year-old trans woman who is an aged care worker. So there was the Royal Commission, obviously this is all in the context of, and then the kind of response is really what I want to talk about from LHA's perspective about the recommendations and what we said in response. So following its release, we at LGBTIQ Health Australia drafted a response entitled Care, Dignity and Respect. So we do believe that the implementation of the Royal Commission recommendations have the potential to go a significant way to addressing concerns raised by older LGBTI people. However, I have to be clear that LHA and LGBTI communities more broadly were deeply disappointed that there wasn't, I should say, a single recommendation across the total 148 that specifically named and addressed the needs of LGBTI people. I will enumerate the specific recommendations we made in our Care, Dignity and Respect response paper. So one, that the proposed new Aged Care Act, which some of you may know is currently being consulted on, it's due to take effect in the middle of next year. The new Aged Care Act being truly human rights based with a clear focus on tangible outcomes for older LGBTI people. The review of the aged care quality standards, including the concept of cultural safety and trauma-informed care, as well as physical elements like personal care, nutrition, and medical management. Specialist LGBTI awareness training organisations, including Silver Rainbow, which is an LHA program, and other LGBTIQ health organisations receiving increased funding to provide for diversity, difference, complexity, and individuality. Further funding being secured to expand the LGBTIQ+ community visitors schemes as part of the Aged Care Voluntary Visitors Scheme. So basically there are fantastic schemes around, but they need expansion. That's important. Budget allocations for aged care services reaching older LGBTI people through select tender to LGBTI specialist organisations, ideally community controlled. The aged care diversity framework being mandatory. It's quite a lot here, so bear with me. Existing governance and advisory structures being maintained through the transition. Timeframes for implementation of the recommendations being accelerated. Older LGBTI people with lived experience of the aged care system participating in advisory groups at all levels. And last, the collection of data about LGBTI plus communities at all levels conforming to the 2020 ABS standard for sex, gender, variations of sex characteristics, and sexual orientation. So quite a few things that we thought were priorities in response to that. So the final thing, aware of time, and also that we're here largely to hear from Robert, I just want to touch on the topic areas of a document that we have, I guess, as our kind of guiding aged care priorities or aging priorities going forward. And it's entitled Policy Commitments for Older LGBTIQ+ Australians, which is the summary of them, and the 5 policy statements, and the topic names is all I'm going to share with you for this moment. Number 1, rights, diversity and accessibility in home care and residential aged care. 2, consistent and reliable data for and about older LGBTI people. 3, adequate funding and robust governance. 4, quality assurance in aged care for LGBTI older people. And 5, a skilled and knowledgeable aged care workforce. So I think I'll leave it there. And I think, James, any questions we'll do at the end if I'm not mistaken. So thank you for listening.
Thank you, Michael. Yes, the Q&A is open. So if you have questions along the way, please add them into the Q&A section and we'll come back to them after Robert's presentation. So, Robert, I'd like to now turn to you, and I'm sure everyone is waiting to hear from you.
Well, waiting if for no other reason that I kept you all waiting while I got my technical stuff sorted. So I am sincerely sorry to all of you for that, and really pleased to have this opportunity to talk with you all and be part of a conversation with Michael around what's happening post the Royal Commission for the LGBTI community in aged care. And do you have some slides from me, James?
I do.
Perfect. So we can probably jump on to the next slide, if you don't mind.
Sorry about that. I've lost my controls.
There we go. Perfect. So I guess this just calls out a quote from the Royal Commission final report, and that recognition that people's life histories, their experiences of trauma, their cultural needs should be recognised and responded to appropriately, and then in bold, diversity should be core business in aged care. And I hear what Michael was saying around the disappointment that there wasn't a specific recommendation in the Royal Commission report around LGBTI needs and how we might make aged care better specifically for those communities. But there is a hook there, and I guess a benchmark for us to measure all of the reform work that we're doing in aged care in terms of, are we meeting that objective that diversity should be core business in aged care. So what I thought I'd do today is talk you through a few of the reforms that are underway at the moment and where there's an LGBTI link in there. And the first of those, which Michael sort of already alluded to, is the new Aged Care Act. We might jump onto the next slide. Thanks, James. This is a really busy slide, but what it's there to highlight is that the new Aged Care Act that we're consulting on at the moment, and that will be introduced to Parliament next year, is intended to completely replace the Aged Care Act that we have at the moment. And one of the foundational changes to that act is a change in the constitutional basis of the act, so no longer relying on the corporation's power, and also being a rights-based act. It starts from the point of what are the needs of an older person in aged care and how does the system respond to that, rather than the current structure that's focused on how does the government pay subsidies to aged care provider organisations. And we might just jump on to the next slide. Thanks, James, which talks a little bit more about what does it mean to have a rights-based act? And I think this is potentially a really profound change, both at that service provider level in terms of an obligation to ask or to think about the rights of a person accessing an aged care service, but also in terms of the obligations to place on people like me trying to manage the whole aged care system in terms of how we think about the individuals and the unique circumstances of everyone who comes into the aged care system. So we have done some consultation on this already in the last few months, and what the slide you're seeing is part of the consultations that we put out in that process. And the draft set of rights do talk fairly clearly about the need for culturally safe, culturally appropriate, trauma-aware and healing-informed care. They talk about a right for aged care to be delivered in a way that is accessible and suitable for individuals living with dementia or with other cognitive impairments. And we've added, following the consultation process, I think a few things that are relevant to LGBTI communities. And obviously this is still the draft that will come out shortly as an exposure draft. There'll be a lot of parliamentary process and further consultation around this, but this is where we're sitting at the moment, at least. So we have included some additional references in the draft of the Statement of Rights around intimate and sexual relationships, around freedom from sexual misconduct and coercion, around recognising an individual's spirituality, around the right to accessible complaints mechanisms. And one of the other parts of the new Act will be pathways for upholding those rights, and that'll be part of the consultation that we have around the exposure draft as well, is what is the mechanisms that will be in place to uphold the rights and principles of the new Aged Care Act. We might then jump, if we can, James, to the next slide in terms of where to next with the new Aged Care Act. The government has indicated they would like to release a full exposure draft of the new Act by the end of this calendar year. So that means in the next few weeks potentially, but ultimately that's a decision for Cabinet to make around what text will be released and when. We also have a webinar coming up on the new Aged Care Act itself. That's currently slated for the 14th of December, and there's a link there via the Aged Care Engagement Hub that you can register if you'd like to participate in that. One of the other things that's going to go along with the new Aged Care Act is a further strengthened set of quality standards. I might ask you to bring that next slide up when you get a moment, James. And Michael has already referred to this work as well. So the Royal Commission recommended that a review of the quality standards be undertaken. They sort of had recommended a bit by bit approach, and government ultimately decided to actually review the whole lot in one go. That's resulted in a revised draft of the quality standards. They have been piloted through the Aged Care Quality and Safety Commission, and the intention is that these will be implemented when the new Act comes into effect. So the new Act will have to come into effect to give authority for the new quality standards to come in. One of the things that for me is significant around the new quality standards is that there is much stronger recognition of diversity throughout the standards. And what you've got there is the text of part of the first standard, which is around the person in aged care. You'll see that there is an obligation there around identifying the individual's background, their culture, their diversity, their beliefs. There's an obligation there to deliver care that meets the needs of people from the full range of diverse backgrounds, and to deliver care that is culturally safe, trauma-aware and healing-informed. And that language comes through in several places through the quality standards, including in relation to go to one of Michael's points, a requirement for aged care providers to train their staff in those elements as core elements of aged care. And then finally, point 3, I think is particularly relevant for the LGBTI community around the right to respect the autonomy and rights of older people, including the right to intimacy and sexual and gender expression. So again, there is some work to do, both in terms of having this formally legislated, and there's some work for the Quality and Safety Commission to do around the guidance material that supports implementation and assessment against these quality standards. But I think there are some really significant improvements coming through there as well. And to go to one of Michael's other points, I think there is a place for us to use the diversity action plan that we have as part of that guidance around how do we use, what does culturally appropriate care, what does safe care look like for the LGBTI community. Let's move on to the next slide if we can, please, James. So one of the other things that the Royal Commission called out, and as you heard from Michael, was a particular focus of LHA's response, was the community visitors scheme. And the Royal Commission recommended quite a substantial increase in the size of that program, and a renaming to call what used to be the CVS program the Aged Care Volunteer Visitors Scheme. And government did agree both to that renaming and to the significant increase in funding. There was an open competitive grant round to bring those extra places online, and they took effect from the 1st of July this year. And we move on to the next slide. Thanks, James. So for those who don't know, CVS is a free service, or not CVS anymore. The Community Volunteer Visitor Scheme is a free service that's there to provide friendship and companionship to older people. The Royal Commission heard how important it was for people receiving aged care in general, but also the significant role it plays in communities like the LGBTI community to have a friendly face who is trusted and safe and comes from the same background, being part of that social connection and well-being. And I know from my own experience working with this program, what a great job and how important some of the LGBTI specific community visitor services have been and continue to be. So we go on to the next slide, James. Part of the new program is that people can, or visitor scheme providers can nominate to particularly service people from diverse backgrounds, including LGBTI people. There are 141 organisations across Australia that have nominated to serve one or more diverse groups. And I think significantly, following this most recent tender, we now have an LGBTI specific service provider in every state and territory, and that's a significant improvement on what we had under the previous scheme. And if we just skip quickly past the next slide, thanks, James, there's a couple of resource points and contacts there. But I want to talk as well about the Support at Home program, which is one of the other really big reforms that is underway at the moment. And again, there are a number of decisions for government still to make in terms of the funding and the legislation to implement this. But we've been having the conversation around Support at Home for a long time now. And I think there are some elements that are particularly, hopefully beneficial for diverse communities, including the LGBTI community. And the ones I particularly wanted to call out were thin market grants. So an idea that where there is not enough suitable provision of care in the system for a particular group of people, and that might be because of geography, but it might be because of the particular needs of a community group, there's capacity for what's called a thin market grant, some extra funding to help face and manage the costs of delivering care. And I think particularly also the idea of pooled funding. So the potential for people from the same community who live close together to pool their home care funding and use the buying power that gives them to develop services that work for them as a community and get some better buying power and economies of scale from that funding. Next slide, if you don't mind. Thanks, James. The other thing that I wanted to share with you is the My Aged Care Provider Specialisation Verification Scheme. And this was an explicit recommendation of the Royal Commission. Providers on My Aged Care have been able for some time to nominate they specialise in serving the needs of a specific group. But up prior to the Royal Commission, that was always self-identified by providers. There wasn't any verification. There wasn't a standard definition of what does specialisation means. That's now changed. Since the middle of 2022, providers have needed to apply to have specialisation verification, their specialisation claims verified. And from earlier this year in February, we turned off any unverified specialisation. So now if you go and look at My Aged Care, and you look for a provider that specialises in LGBTI care, you know that the people, the providers that have ticked that box have genuinely met a documented threshold of specialisation and care. I think there is a challenge for us that we would like to see more aged care providers identifying and applying for specialisation, and we're working both through the aged care sector to promote this scheme, to promote its benefits, but we do also encourage those of you that are engaging with aged care providers in this space to encourage them to look at this as a really important way of helping find genuinely specialised services to meet people's needs. Thanks, James. This is my final slide, just to touch on a couple of other, what I think are important reforms and initiatives. Michael already mentioned data, and government is working on a new minimum data set for aged care to improve the quality of the data and the consistency of the data that we capture. And one of the key questions there is how do we better capture data around the diversity of the people accessing aged care, both so that we can identify people and respond to their needs, but also so at a system level, we can hold ourselves to account for whether we are being genuinely accessible as a system and delivering quality care as a system for all ranges of diversity, but particularly today for the LGBTI community. The resident experience survey in that top point is similar. So part of the new star rating system is that every residential aged care provider has an independent organisation go in and visit and survey 20% of their residents, ask them how they find that experience of care, and that informs the star rating that provider gets. In that experience survey, we do ask people to identify as LGBT or I, or as one of the other diverse groups. And at a system level, that lets us track whether the experience of different diverse groups is better or worse than the mainstream, and tell us whether we're doing a good job or not at that systemic level as well. So another, I think, a good example of using data to drive or to hold ourselves to account for the way we deliver for diversity in aged care. And finally, the Planning for Diversity project, which is being delivered by the Older Persons Advocacy Network. It's an initiative that spans all forms of diversity, but what it really does is challenge aged care providers to think about the diversity of the community that they're serving. Look in a hard data way at what is the diversity of the community that I'm serving, and then ask, is that mirrored within my service? And if it's not, why isn't it? What strategies do I need to have in place so that the people accessing my service mirrors the diversity of the community that I'm serving, and provide some practical tips on how a provider might do that. So I think that's hopefully another significant cultural change that we're trying to support the sector to adopt. So that brings me to the end. Thank you, James, for guiding me through the slides. I'm really happy to join Michael in some conversations and questions.
Thank you, Robert. That was a very valuable overview. We've got a couple that I think are coming in around the aged care specialisation verification process and what that means. So there's one question asking, could you give us an example or two of what going beyond the standard obligations might look like? And reflected in that is another sort of observation, I think perhaps more than a question, that the verification process has actually meant that there are next to no services that have evidenced this at this stage. And I'm wondering if you could perhaps comment on what are basic standards of service that should be expected by everyone, and what it actually means to specialise.
Yeah, absolutely. And we do have a document for all the diverse groups that specifies what the criteria are. And so very happy, James, through you to share that link with participants after the session today as well. There are two types of proof that aged care providers can offer to demonstrate specialisation. There's what's called Tier 1 criteria, which basically mean you automatically demonstrate that you are specialised. For the LGBTI community, that's having the Silver Rainbow accreditation. If you've been through that independent accreditation process, you don't need to do anything more. You are specialised. There's also then what's called Tier 2 criteria, and you need to meet a combination of these, usually 4 factors. And it looks at things like, and it's different for each of the diverse groups, but do you have LGBTI staff members who are funded and resourced as part of their role, not as their full-time role, but as part of their role to be a champion for appropriate care and awareness of LGBTI issues within the service environment? Do you have people with lived experience on your governance board? Do you have additional policies or practices in place that are specifically around how you as an organisation are welcoming and inclusive of the LGBTI community? So they're the kinds of things that mean that you are specialising, whereas standard care is that requirement defining the aged care quality standards to be, in the words of the new standards, culturally appropriate, safe, trauma-informed and healing aware, and for, in the current standards, the words elude me slightly, but are similarly around being respectful and inclusive of diversity. So that's the difference between the two. In terms of the comment, I think absolutely yes, take the point, and it's one of the questions that we're working through really actively in the department at the moment. To be honest, I hear both sides of the fence from diverse consumers. Some say, actually, we really want the confidence people that are getting that tick are genuinely specialised, so don't change your thresholds at all. Others are sort of more concerned about, we want visibility, we want certainty, and so we'd like to see more people specialised. I believe there are probably more providers that are specialised out there that haven't yet applied, and so we're doing two things. We are both redoubling our efforts to promote this change to the sector, and I think one of the challenges we've had is there is so much change happening in aged care at the moment that this particular change possibly hasn't got the attention that from providers that we would have liked, but also doing some work with providers to try and explain what we see as the benefits of being specialised and understand from them what are the barriers and the reasons that they're not applying for verification.
Thanks, Robert. We're over our advertised time, but I'm hoping since we started late, you and everyone might be able to respond to a couple more questions before we finish up. We've got one from Liv at Working It Out in Tasmania, asking, will the data capture be consistent across all of healthcare? A lot of older people move from healthcare to aged care services and transition back and forth. And mentioning the requirement to use the ABS 2020 standard as being rolled out in some places.
So I think that is part of the challenge that we're also grappling with, Liv. So we're doing the work around the minimum data standard. We're also doing some work around a digital strategy for aged care. And some of the questions that we're grappling with that is, how can we improve the transition of data between, as you say, a health system and an aged care system, but also how can we capture a person's story once and hold that and make it available to all the parts of the aged care system, so that people aren't having to tell their story over and over again, while also having the controls that people want in terms of the privacy and the sensitivity of their data. So not complete yet, but absolutely an area where we're doing work at the moment.
Thanks, Rob. And I think probably a quick question. Are there any online support networks to support LGBTI older folks in regional areas online? People who are vulnerable and unable to attend in-person events?
I have to say, James, my answer to that is I'm not sure. There are definitely, the volunteer visitor scheme operates around the country, but in terms of online networks specifically for LGBTI people, I'm not sure what the answer to that is.
Okay. We'll check and do a follow-up if we can, but I think there might not be as well. And Rob, final question, and we'll wind up then. Will the Commonwealth be making the residential aged care survey results around diversity available to relevant community organisations?
My answer to that's maybe at the moment. So one of the pieces of work that my team and I are doing is, and again goes to an explicit Royal Commission recommendation, using data every year to ask the question, how well are we meeting the needs of diverse communities at a local level? Where are there gaps and what are we going to do about it? And so the consumer experience reports are absolutely going to be part of that. I think we're working through some practical questions at the moment about whether we have enough quality and enough responses that have identified for each of the diverse groups to make that publicly available. But my ambition would be, even if it's not in this first report, that it's available in future iterations of the report as we get better and better.
Thank you, Rob. And I'd like to particularly say thanks for your time today. It looks like we've caught you in between other activities and on the run. And I'm glad we're able to resolve the technical problems and get you online.
Yeah, and my apologies again to everyone for making it such a late start.
Yeah. And thank you also to Michael for his introduction about LGBTIQ Health Australia's consultations with older people for the Aged Care Royal Commission. I've just popped into our chat a brief post-webinar survey, and I would invite everyone to fill that out and give us some feedback, and please be kind about our late start. So on that note, thank you everyone, and hope to see you at our next webinar in a week's time as a follow-up to the AusPath conference and reflections on trans health. Thank you, Robert. Thank you, Michael. See you all.